This is episode 3 of the Health Translations podcast. Health Translations is Australia's largest directory for translated health and wellbeing resources. There are over 18,000 resources available in more than 105 languages. This series explores the way culture, language and health interact. In each episode, we talk to healthcare professionals and community members about the role translated health information plays in their lives. My name is Nicola and I work for the Centre for Culture, Ethnicity and Health, a not-for-profit organisation that manages health translations on behalf of the Department of Health and Human Services. Today we're speaking with Emma Draysens, the National Coordinator of Diverse Community Programs, and Patricia Lee, Multicultural Project Officer at Positive Partnerships.
Hi Patricia and Emma, thank you so much for joining us today on the Health Translations podcast. Could you please tell me about Positive Partnerships, how it came to be, and what do the words Positive Partnerships actually mean?
Sure, absolutely. It's lovely to be here with you. We are a federally funded program and our key aim is to improve the educational outcomes of school-age students on the autism spectrum. We've got lots of different parts of the programs and resources that we have. We work with parents, we work with school teams, and we work with community members. We have lots of online learning and webinars available, and we also have fact sheets and resources.
Brilliant. And are any of these fact sheets and resources culturally responsive? Are they designed for culturally and linguistically diverse communities?
Yeah, absolutely. So all of the resources that we've developed that are on the Health Translation Directory website have been developed in collaboration with members of multicultural communities, and we've also had community feedback on all of the resources as well. We often find when we're out at workshops and working with families and schools that new topics come up as well. We can see where there might not be some information that already exists, so we also try and be responsive to what information is most relevant.
Great. Can you give me an example of working with the community and what kind of feedback you've gotten on one of the resources you've developed?
Yeah, sure. So in some culture and language groups, the medical or diagnostic term Autism Spectrum Disorder has actually been translated to be Autism Spectrum Disease, and we're very aware that autism is not a disease, but in some cultures that is one of the myths about autism. So it's been really important for us to seek feedback from professionals and families in the community from that language and cultural group to make sure that our information's evidence-based and accurate and busting myths rather than reinforcing them.
Positive Partnerships has actually developed a really great resource around facts and myths about autism, which is on Health Translations. Can I talk to you about some of those myths and maybe you can clarify, the facts about them? Is that all right?
Yeah, absolutely.
So one of the myths around autism is that it's the fault of the mother. Why is that a myth in the first place? Where does that come from?
That's a really interesting one, and it probably has history across different cultures, but even within, Western cultures, not that long ago, there was actually a theory about refrigerator mothers. So the way mothers interacted with their children could actually cause them to be on the autism spectrum. We know that is completely untrue, but I guess it was a theory at one time. So I think in other cultures it's something that possibly still resonates. And we found that fact sheet to be really important because it does provide the evidence, the research, the science behind what we know. Also still some of the areas that we don't understand yet, but we also know that listening to the experiences of adults on the autism spectrum is really important. What helps them, what supports them, and a lot of the research is heading more in that direction, which is fantastic.
Great. And I know you do primarily target a younger demographic, so it's children and their communities. That's right?
Yes, so any school-aged children, sort of 5 to 18 years of age, but we find some of our resources are also helpful for younger children, younger families, and some of our tools can also help, beyond, transition beyond high school.
Yes. So if that's the case, could you speak about early intervention and the diagnosis process and how the fact sheets inform that process?
There's lots and lots of research to support the benefits of early intervention. One of our, key messages whenever we're speaking with families is if, regardless of the age of the child, if they're concerned, find someone that they can trust to talk to. At Positive Partnerships, we really believe in that strong relationship between home and school, but it might be somebody else in the community or a medical professional that parents might feel comfortable to turn to. We also a lot of the tools and resources we've developed can be used with any child with any diverse learning needs. So whether a child has a diagnosis of autism or not, it's still important to focus on them as an individual, their strengths, their interests, what they can do really well, but also what they need support with. So really encouraging families to move away from that deficit-based model and focus on their strengths. So a lot of the tools and resources mention autism, but we also find that for some families using that word may not be relevant for them where they're at in their journey, but we can talk about their child as a young person.
Right, because I understand there's quite a lot of stigma around autism, and so not everybody does use that term. Can you both speak a little bit about that stigma? I know there was an interesting case in the Nepali community. Is that right?
There was one in the Chinese community recently that Patricia might like to talk about in terms of the language used.
Okay, sure. For Chinese, if you look at autism, they will translate it into something like self or restricted, and it will have the implications of very negative, and it's kind of a disease. So that's for Chinese translations. So it's not completely reflect what's exactly how diversified it can be for autism spectrum. But unfortunately, you will never be able to find a very accurate or exact term to perfectly translate autism from English to Chinese. That's something, we tried our best, but you can't really do anything about that, because this was a term have a kind of a restricted and repetitive behaviors or rituals, which will be very confusing and also not the one used by doctors or psychologists, and parents will be also confused. So I think this is kind of the cultural issues related to the in particular translation.
And I think in that case, Patricia, the term repetitive behaviours or restricted interests was translated quite literally to mean children that were highly traditional in their behaviour or quite religious. What it actually is talking about is children that we might see them engaging in behaviours over and over again, and they may be doing that to understand. It was really important to have a discussion around the language in that context so that we're not confusing families further.
Yeah, absolutely.
Yes.
And with the resources that you do develop, because you do have to tailor them to the different communities, how do you determine what topics to cover? You mentioned before that you identify gaps. Could you give an example of one such gap that you might have encountered and how you create a resource to address that?
I guess in all of the work we do with parents, schools and communities, we try and partner with trusted organisations, and we're guided by them as to what the level of knowledge around autism might be within that community. So we try and, I guess, tailor topics to the conversations that might be emerging for families in that community. We also are currently developing a new resource specifically for multicultural communities about autism, so an introductory conversation that represents diverse families, diverse experiences, families that may have accessed early intervention, some families that may have had a later diagnosis or a misdiagnosis, and possibly for families that link in with our program sometimes, they may feel that their child has some characteristics. They're not sure, but they've never met another parent of a child on the spectrum. So coming into that supportive group environment where they can access up-to-date information sometimes just helps guide their next steps.
This episode is brought to you by CEH, the Center for Culture, Ethnicity and Health. CEH works to improve the health of people from migrant, refugee and asylum seeker backgrounds. CEH offers professional development to individuals and organizations in the areas of culture competence, health literacy, working with interpreters, and more. Through this training, workplaces have been able to improve their inclusivity, efficiency, and their responses to people from migrant and refugee backgrounds. To find out more, go to www.ceh.org.au.
So if a parent is concerned about their child's behaviour, is their first port of call to contact Positive Partnerships? Is that the step that they should take?
They're welcome to come to our website and access information. Any places around Australia where we're holding a workshop for community or for parents, they're welcome to connect with us. But we would encourage them to speak either with a trusted person at school or with a medical professional that can give them a referral to someone like a speech pathologist, for example, who can start giving them some practical advice. Someone in their local community. There's also some great information lines that families can call using an interpreter that might guide them on local information that can help them.
Yes.
So you mentioned that a speech pathologist might be one of the professionals that might be able to assist a family who does have a child on the autism spectrum. What are some of the other sort of professionals that you might engage in that capacity?
One of our key resources covers professionals, allied health professionals that are available to support families. It's called Who Can Help. It's quite a simple English document. We've translated into 11 languages at the moment, and it outlines the role of occupational therapists as well, psychologists, social workers. We find sometimes there's misunderstandings about the roles that those people can play. For example, if a child is speaking, albeit differently, they may not need to see a speech pathologist, or that occupational therapists just help children with handwriting, whereas we know that they support children with lots of functional, practical skills, including sensory processing. So we try and encourage families just to have clear information about how those professionals can help, so that they may feel more comfortable to access and link in.
Okay, and how do you determine which languages that your resources are going to be translated into?
That's a very good question.
Yes.
I guess we're guided by data, so the largest numbers of communities within Australia, but particularly that would have school-aged children. We're also conscious we do encourage grandparents to come along to our workshops sometimes. Even if parents have quite good English language proficiency and feel quite comfortable speaking in English, they may prefer to have more complex medical information and fact sheets in one of their first languages, or share it with someone from an extended family member from an older generation. I guess the data tells part of the picture. You know, we're open to feedback from organisations particularly that are supporting multicultural families as to which communities this is an emerging conversation in. So, for example, we have resources in Nepali, even though that there is not a large population of Nepalese people in Australia. It's growing, and particularly in terms of their health literacy. Children's development and diversity has been an emerging conversation, and we've really found that community quite open and supportive about talking about autism.
How do you get in touch with the community? So obviously people do come to your website, but how else do you reach out to different communities? Because sometimes, like you said, people aren't aware of, what is happening. Do you go to libraries or churches, or what's your process with that?
Yeah, it's quite varied. Pat, you can talk about the process with the groups here in Melbourne.
Yeah, I think first of all, if we know some of them beforehand, so it's easier. So I will just connect them with us. Given our previous experience, I actually do a research on the website, and then we identify a group, and somehow we start contact the group, and then we introduce ourselves, and because that is a group with most of the members having children on the spectrum, so we can easily connect it with each other.
How do you reach that group though?
So I think the first step is if we have any our previous relationship connections, our own business network or personal network, that will be the first step. If we couldn't have that kind of contact, then the next one, as I said earlier, I will do research on the website and identify a group, and then we will kind of a cold call. So
cold calling, okay, great,
that's the way we start. And but somehow if you've been in the community for a while, somehow you will know one or two members of each of those community groups, and when you talk about you introduce each other, then somehow you will connect to you will realize you do have some common friends.
Yeah. And I would say having someone within that community as part of our organisation has been an invaluable asset. Patricia's contributions and ability to connect with people of her own culture and the languages that you speak has really helped us to connect with the right people, support the right people, and have a really sort of authentic working relationship with those people.
And one thing probably is better because we know the culture definitely better, so we know how to approach them more effectively, and then we know what something we we shouldn't say, that kind of things. And when we even organize workshops or information sessions, and then we know what they would like to have, such as Emma mentioned before, we will have the translated resources. That's something very useful and will be more effectively engage them, as well as we arrange interpreter. So that's another good thing, for engaging the multicultural communities.
Absolutely.
And we've also been guided by you, Patricia, on, culturally relevant and appropriate places to hold the venue. Yummy food.
Yes, we can't miss.
Very important.
Yes, some yummy, delicious food to cater for one particular group of people or culture. That's also another good thing to be more effectively engage people.
Do you find, so when speaking about those venues, what venues would be not culturally appropriate that you might have had to veto in the past? Are there certain locations that really stand out as great places to engage communities?
For example, for Chinese community, very practical. It doesn't have to be a very cozy or very grand venue. So what they treasure more is a convenience and also familiar place.
Yeah, it's really interesting to hear about the convenience aspect as well, because I think we encounter that when we've got community groups. Sometimes things aren't held at good times for a community. If they've got children or they're working, they're not going to be able to attend a group. And similarly, we try and, if we're addressing a group in the West, we want to hold the event in the West and make it near public transport and accessible.
Yes.
And it sounds like Positive Partnerships does the same with the programs and workshops that you do.
Absolutely.
Yes.
Yeah, local. Yes. Although we have had one mum drove for an hour and a half to get to a workshop.
To a workshop because she sees the value, so she doesn't mind. So the thing is, the value and the practical strategies, would be something they treasure more.
Yeah, great. Well, it shows how important the work you're doing is if people are prepared to travel that far to access it.
Yes.
Yeah, and we've also tried to keep the sessions shorter, so we typically run full-day workshops. Feedback from the community as well suggested, 2.5 hours of information is enough to take on board at one time. We, sometimes come back to run a second or third session with some weeks gap in between, but also so people can keep work and family commitments. We also do run workshops on the weekends as well, particularly if we're working alongside, community organisations or language schools that have events on the weekend. We'll sometimes run an information session for families while children are engaged in cultural events.
Perfect, because then you don't have to worry about maybe a babysitter or something like that.
That's right.
Exactly.
That's a great strategy for
Yes.
For people who are interested in developing resources for their organisation to better engage with community members, how do you go about it?
So for one of our key resources of Family Journey, which it describes the story of a migrant family coming to Australia, navigating their way through all of the different systems and processes here, and then learning that their child is developing differently. That was developed with a focus group of people from different cultures that included professionals and parents who themselves had a child on the spectrum. We also had fathers as part of that reference and focus group, and the feedback from the men in the group was that it was really important that resource was told from the perspective of a male, of a dad, to try and connect with some of the dads in different communities that, may be looking for a resource or information that's relevant for them, that has their voice as well. So they really guided what that resource looked like. They told us it was important that it explored some of the information and experiences around extended family members, so parents being told possibly boys talk later than girls, don't worry, they'll catch up, or your child just needs more discipline, or even being told by professionals it's because your child's learning English and it's not their first language, that's why they're having difficulty at school.
Right, okay, yeah.
So it really guided all of the key conversation and discussion points within that resource. It was based on their experiences.
So what other family members did you need to consider when you were developing a family journey?
For example, a family journey, we have mentioned grandparents in the video. I think this is really good because for some multicultural community, say for example Chinese community, grandparents are playing a more and more important role than before. You can see some young parents, they will ask their parents, that is grandparents, to come over long way from China to Australia, probably for 3 months, because that's what their visa will only allow, to stay here for 3 months and to look after their grandchildren. After 3 months, they will go back to where they come from and apply the visa again. So they will use this kind of model for the grandparents to come over here and help look after the grandchildren. Actually, more of the family time the children actually spend with the grandparents. So you can see if grandparents knows how to help their grandchildren, that will definitely help a lot for the whole growth, for the children.
Right, so it's about including the entire family in the process and giving them all information.
Yeah, so it's not just about the parents now. You have to look at from a broader family picture. So grandparents or even aunties sometimes. So these are the people that we have to also engage.
Right, and where can families go to access more information about positive partnerships?
The best place would be through the Health Translation Directory website or our website, which is positivepartnerships.com.au.
Thank you so much. Thank you both for coming on the podcast. It's been great talking to you.
Oh, it's been our pleasure.
My
Thank
pleasure.
you.
Yeah, thank you.
That was Emma Draysons and Patricia Lee from Positive Partnerships. We've been talking about the way focus groups and community consultation can guide a resource in unexpected ways, cultural considerations when running workshops, misunderstandings about autism spectrum disorder, and where parents, schools and communities can go for support. The music for this podcast was created by Zeb Rogerson. This episode was produced by Nicola Nemrick and Annie Tilak-Benton. The podcast was made possible by the Centre for Culture, Ethnicity and Health. For show notes and to learn more, head to www.ceh.org.au/podcast.